It looks like we're live. We are live on numerous platforms, and we wanted to have this conversation regarding your experience, Elizabeth. I was just on the phone with you and I said, we need to go live and we need to talk about this because I feel like there's going to be many others who have gone through this and that need to hear this. And so I want you to tell people what you just told me regarding your experience with getting a mammogram since it is breast cancer awareness month. I think this is really important to discuss. So let's just start with like what you told me. Why did you decide and where did you decide to go get your mammogram?
Okay, so I got to go back a couple years. A couple years ago, I had found a lump in my breast. And at that time, I had a job that provided me with very good insurance. So I had gone to actually Cape Canaveral Hospital. I had a mammogram done there. And then that was followed up with a biopsy, which, at that point in time, I think I remember talking to you when that happened. And, I was mind blown at the amount of bruising and pain just from the biopsy. And I kept thinking, my God, women that actually go through cancer, like this was just the biopsy. Like I ended up taking like a week off of work afterwards because I was literally bruised from like my collarbone all the way down to my belly button from just a biopsy. So thank God that came out clear. Everything was fine. It was just something that they wanted me to keep an eye on. So afterwards, I've gone through some stuff. I ended up in a housing problem. I ended up losing my job, but not, nothing bad had happened. I was going to make a move and things just didn't work out with my employment there. So you fast forward 2 years and here we are now. And I've kind of, with everything going on in my life, really just kind of pushed that out of my mind. I was having a hard time even dealing with the comprehension of, I need to follow up on this and I need to continue to monitor it because of the financial situation, the housing situation, and just numerous things that were going on in my life. So I really just kind of pushed it out of my mind until a couple weeks ago when the young woman went out in Cocoa and on Merritt Island, shirtless, showing her scars from having her breast removed from breast cancer. And she was out there reminding people to get their mammograms.
And that was April. And we did do a article on her in the Advocate's Voice, and she's taking donations to help women with mammograms. So if you guys want to learn more about her story, I think people should definitely visit that article because it really tells the reality of what happens when people get breast cancer, not trying to scare people, but it should encourage people to do exactly what you're about to tell everyone that you did.
Right. So I saw her and I'd read the article and fortunately had the opportunity to meet her, and what an incredible spirit that person is. April, if you're listening, watching, like, thank you so much. So she was out there reminding people to get their mammograms, and I saw an advertisement from Parish Medical Center that they were doing mammograms for $60. I am not in a great financial position right now, so I needed to take advantage of that while it was going on. It's Breast Cancer Awareness Month, and I thought, well, you know what? This is totally worth the $60 for me to go and do this. So I went in a couple weeks ago. I had the mammogram done. I paid my $60, and they had asked me at the time if I had a doctor to send the reports to. And I do not have a doctor at this time. I don't have insurance. I really don't have a lot of money. So, I'm like, I don't know where to send it because I don't have a doctor and I don't know what to tell you. So they were like, okay, let's just go ahead and move forward, get this thing done. Maybe we can just take a look at it for you and everything will be okay. So I get a letter. It's dated October 18th. telling me, we are pleased to inform you the results of your screening mammogram performed on the 17th showed no suspicious abnormality. Okay, that's awesome. That is fantastic. I am so relieved and so glad to hear that. And as relieved as I was, that was followed up with a bill. A bill of $312. I already paid the $60. I paid the $60 when I went that was advertised for me to get a mammogram because I don't have insurance and I don't have a lot of money and I don't have anybody paying my bills for me. So, you know, that's
and
where
so
we're
you're
at
telling
now.
me this, and I think that everyone that watches this needs to know, because it infuriates me to hear that they're advertising mammograms for $60 and not telling people about these hidden costs and then sending you a bill for that amount. I think that is just, it's almost like a what do you call, like a bait and switch. This is why I get frustrated with hospitals. This is why I get frustrated with the United States healthcare. As you know, I help people like yourself navigate the healthcare system, and it is just completely horrendous what people are put through. Most people, they have this mindset. We're talking about breast cancer awareness right now. They have this mindset that I don't even want to know, because if I find out I have cancer, what am I going to do anyway? I can't afford to get chemotherapy. I can't afford
to. That's really where I've been for the last couple years, is kind of intentionally burying my head in the sand because I couldn't deal with it. And even if something came back where I was ill, how on earth am I going to afford the medical care to follow up with that? You know, it's very frustrating. And I do want to add that the staff there at the facility at Parrish, they were so kind. They were attentive. They made me feel very comfortable. Like, this is nothing against the people that are working there at the hospital.
Yeah, that's good that you pointed that out.
These are, you know, these are nurses. These are staff members, admins that are in there, and they are doing a phenomenal job. So we're talking about policy. We're, you know, these are policy problems with a lot of these medical facilities. So I also wanted to add in there that today, I got like 6 phone calls from Parrish, and I wasn't able to answer the phone. I was working. So I finally got to the phone this afternoon, and they say, Ms. Baker, we need to have a doctor's name so that you can have this report read. And I'm like, but you already sent me a letter saying that I was in the clear, you know? So why do you need to have this report read if I'm in the clear, you know? Like, I don't understand that. So I think more than anything, I'm confused. I don't quite understand, like, why are you sending me a letter telling me it's clear if you need a doctor to send it to? Because, you know, you're telling me that nobody can read this, but apparently it's already been read. So now I'm going to have to call them back and try to figure out, was this read? Was it not?
So,
am I at risk? Like, I seriously do not know where I stand right now. On top of, apparently I'm going to have to try to come up with $312 to pay the rest of this bill.
No, they should not be advertising services at the hospital for $60 and then adding in these additional charges. And so one of the things that I had brought when we were talking about this, I was like, you know, I had a biopsy done a few years ago because, you know, that I had some stuff going on, and I called because there was a new law passed by our legislators that they have to tell you the cost of your procedures. I had called, and this place was affiliated with Parrish Medical Center. And I had said, I would like the full amount of what I am going to have to pay for this procedure. Again, I like that you brought up that this has nothing to do with the staff. This has nothing to do with the nurses, the doctors. It has everything to do with policy and our healthcare system. And so I asked them. I got sent around and around in circles. Nobody could tell me how much the cost was. They were so, what's the word? confrontational about me asking, like, this is unusual. How dare you ask us how much your procedure is going to be? I mean, that's the attitude I was receiving. Like, this is just unheard of. Why do you care how much? And I said, I live paycheck to paycheck. I need to know, I need to be able to finance in order to pay my bill. And so I would just like to know how much it would be. I told them my insurance. They said, you need to call your insurance. So we got into this situation of passing the buck. Let's, you call your insurance, call my insurance. Insurance said, no, you need to call them, called them back. So it took me days. And when you talk about how you had to call and they're calling you, I mean, this should not be this difficult. You're already dealing with people, especially if you get diagnosed with cancer, especially if they're dealing with health issues. They've already got the amount of stress of that illness in itself. And then you're going to add to people's illness by making a very complex system that is confusing, like you said, very confusing, and just absolutely discouraging. And it's almost like it's done intentionally to make it confusing, because what I just don't understand this whole, it was $60 and you got a $300 bill, but it happened to me as well. They finally gave me a price, and then the next thing you know, so they passed this law in Tallahassee saying that they have to give you the cost, and the next thing you know, they gave me the cost of what they were doing, but I get all these bills, and what they're doing is they're separating them. So they send you a bill for, the laboratory, sending it to the laboratory. Then they send you a bill for the analysis. Then they send you a bill for the doctor to review it. Then they did exactly what they did to you. So I had a concierge doctor at the time that was helping me navigate this, and they refused to release my own medical documents to him. They said I had to get a doctor, a specific doctor, an OBGYN, even though they told me it was fine, that I just needed to watch it. And it's like, well, why do I have to get an OBGYN? I said, now that's more money out of my pocket, because now you have to go pay for the doctor fees. So I know everyone watching this live stream today, this is why I felt it so important to come on here and tell this, because I know we are not alone in these experiences. And in fact, we just got a comment. It says, yes, I had breast cancer in 2016, and they could never give me a cost before any of my surgeries. And that is disgusting.
Well, and you think about any other thing that we have, that we consume, that we purchase. I know when I go to the store that, this apple's going to cost me this much, or if I need to get my car repaired, they give me an estimate. Sure, it's an estimate. It may go up or down a little bit, but I have never one time ever gotten my car fixed and had a mechanic say, oh, well, this is going to be $3,000 more than what you originally did after the fact, after my car was fixed. And then they send me bill after bill and bill, and then ruin my credit, and that is really
what they're doing.
what's happening. So, we have this system. I heard a statistic the other day that just blew my mind, that pharmaceuticals, prescribed medication, is the number 3 cause of death in the United States. That more people die from prescription medications than heroin and cocaine put together. Our system is broken. If that is the way that is, we are broken. Not only do we have these exorbitant medical costs, but I just don't see too many people getting better. I see people taking pills. I see cancer patients, going through years of chemo and radiation and round and round and round, and they still don't win. They still lose that battle. And we talked about the snake oil, and it's no wonder people go to extreme lengths doing things outside of the medical field to try to protect their health. No matter how crazy it sounds, people are desperate. They're desperate, and they want to live. And so they'll try anything, because they know that they don't want to burden their families with these medical costs. They don't want to, and it's not even a want to, they just literally have an inability to pay. I cannot imagine facing hundreds of thousands of dollars in medical bills at this point in time in my life. It's hard to put gas in my car some days. I have to pinch pennies when I go to the grocery store, and I think there's another part of it too, is there is this stigma where if you don't have money, there's something wrong with you. Well, I've never had money in my whole life.
So I want to bring up the Parrish
worked.
Medical Center.
Mm-hmm.
How I just want to point this out because it really does. I wonder how other people feel about this, honestly, but I see all of these billboards that Parrish Medical Center puts up across our area in North Brevard. And I know many hospitals do this, but Parrish is a not-for-profit hospital.
Right.
And I just wonder, because billboards are pretty costly. I mean, they could be a few $1,000s.
Yeah, they're thousands and thousands of dollars.
So
yeah.
I just wonder, if you are a not-for-profit hospital, why aren't you putting that thousands and thousands of dollars into your community, into helping pay for those medical expenses that people can't afford? And then I also question why they aren't addressing prevention and early detection in a way that it's affordable and more accessible. Like when I talk about prevention and environmental health, I talk about our high E. coli numbers in the water. Where are our medical professionals on that front? Why aren't they helping educate the community about PFAS chemicals and the health implications of drinking that? Why aren't they educating our community on harmful algal blooms and just harmful bacteria in general? I don't know if maybe they don't even know about. It's an environmental health, section, but again, it goes back to just how broken our healthcare system is, and there's been a lot of trust eroded by healthcare in general in this country.
And I think you nailed it right there. I think there's a huge, huge disconnect between environmental health and modern medicine. More and more we're finding, specifically with PFAS, we're finding links to diabetes, heart disease, autoimmune disorders, things like Crohn's disease, which I have family members that suffer from. And oftentimes I've spoken with several people within the medical community where they're really undereducated on those issues. I would think that in a community that has such high levels of PFAS in the drinking water and the groundwater, and really being put on the map. I mean, to the point that cities are now taking part in class action lawsuits for the manufacturers of PFAS, that one of the first things they would want to start doing is testing to see where the levels are in our physical bodies. I mean, if nothing else, just to kind of get a baseline of what they're looking at and how many people are truly being affected by these things. So, it's a confusing system. I don't have any answers. I think it's a darn shame that we all pay taxes. We all work hard. We all do the right thing. And we're living in a society where we have homeless veterans and people without health care and people struggling to just keep a roof over their head.
I always say if they wanted to, they could. If they wanted to solve homelessness, they would. If they wanted to solve this healthcare crisis, they would.
Yeah.
If they wanted to solve the environmental health issues, they would. I feel like, there's so many excuses. Oh, where's the money going to come from? Well, you're pouring some of the money into billboards. So let's address that first. I mean, maybe it's just a matter of management of money, management of prioritizing. But I see a hospital in Orlando where people are now, encouraging prevention and addressing those things and really promoting that. So you have the ability to do that. Instead of putting up, you have cancer, come do your services here on billboards, maybe put prevention, maybe encourage better lifestyle and better diet. I would love to see billboards that are from Parrish Medical Center, specifically in North Brevard, that talks about, exercise and diet and how they can help make themselves healthier in this community.
Or giving recommendations on things like, make sure you wash your fruits and vegetables when you get them, make sure that you have a proper water filter in your home. There are a million things that people can do to reduce their exposure to things that may be causing problems. And, I'm just not seeing that coming from the local medical community where they're really pushing that. So,
and how do you trust a
we kind of
system?
froze up there.
I was going to say, how do you trust a system that profits off of, I mean, people say off of illness, but if we're being real, they're profiting off of pharmaceuticals. I mean, my mother worked for Parrish, and I do know that they had representatives that came into their office all of the time that would provide them these fancy lunches and because they want the doctors to write the prescription for their medicine, their pharmaceutical, so it's like, we're never going to get anywhere with our healthcare system in the United States as if they continue to profit the way that they do. My father's chemotherapy pill, I mean, we had to pay with insurance almost $3,000 a month. And they were profiting billions. So that's another.
I think it's not in, I want to be clear here. It's not that I'm saying that Parrish specifically is doing anything illegal, but oftentimes, and more often than not, I think legal and morally right are two completely different things. And we have seen that time and time and time again. What is legally allowed, what is legally right, is not necessarily the right thing to do. It's not necessarily the moral thing to do. So, again, I don't have the answers, but I do think that maybe if people start banding together and standing up against things like this, why is it that somebody with very little money is facing housing problems, is getting a bill for $312 that they never told me I was going to get? They advertised $60. I paid my $60.
And you didn't have insurance, did you?
No, I do not have insurance.
So you were like a self-pay walk-in where they advertised $60 for your mammogram and then they're sending you a $300 bill. I that's unfathomable. I'm
just wondering how many other people got their letters in the mail and got their bills in the mail, and like how many other people, April's out there standing in the middle of the street begging people to get their mammograms, trying to raise money to help women that are exactly in my position to get that screening done, catch it before it gets out of hand, do what you got to do. And like, how many of those people saw that same ad, saw that same thing happen, called, made their appointment, and now have gotten their bills? And
just imagine the added stress.
It seems cruel. It seems cruel.
Especially in this economy. It is extremely cruel. You're going to send an unexpected, basically like a bait and switch. Like you said, what they're doing isn't illegal. It's just immoral. And you're telling people it's $60. You're not expressing or telling them that it's going to be an additional cost for extra stuff. You're not telling them that you aren't going to release their test results to them unless they have a doctor. You're confusing people, telling them you're okay, but maybe you're not because you don't have a doctor. I think that this needs to be talked about. That's why I was like, let's just jump on live. Let's hold this conversation for an online discussion, because I do feel like we're going to have a lot more people coming forward that have had very similar experiences. And I think it's important as a community that we share those experiences, because without sharing this information and those personal experiences, we can't find solutions and we can't start looking for ways to help our community. Like you said, April is out there trying to raise money for mammograms. So maybe instead of promoting that particular hospital, maybe we need to start reaching out to other hospitals, whether in Orlando, whether in South Brevard, and start seeing if they have better services and services that aren't going to advertise for this low cost and then turn around and charge people that are in your position. And so if anybody knows about that, let us know. And if you've had a similar experience, share it in the comments below. You can message us, you can email us. Let us know if you've had similar experiences with this, so that way we can, see if this is a one-time fluke. Maybe you just got a random $300 bill. I don't know.
Right? Yeah, it could happen. Sure.
Possibly, maybe.
I don't know. It's I'm a very private person. I don't air my personal things out here. So this is hard. This is hard for me to discuss, but I think that I'm with you. This is very important to talk about. I'm
Elizabeth, don't feel
people,
bad that you're in this position, because I think there's going to be so many people that are coming into this conversation with us that are going to relate to you, because
and I can't help but have a little bit of, I guess, embarrassment that I'm in the position that I am in my life right now. I can't help that. That's, those are again, we're back to that, like, society's view on, like, you don't have money, what's wrong with you? Well, I don't. I didn't go down that road in my life. So,
well, and I see you, to be fair, I do see you working extremely hard. You're working 3 jobs right now, trying to get back on your feet, trying to beat this economy and the inflation and what's going on. And so, it's not like you're not trying. It's not like you don't have jobs, plural, jobs.
Oh, no. I wish I had time to sit down during the day. I just don't. I am definitely scrambling daily to make sure that I have a roof over my head and food in my belly. And it's difficult. And I know I'm not the only one. I'm by no means feeling sorry for myself. I have a great life. I have beautiful, wonderful friends that I love dearly. And I am so grateful. Like, I still have my mom and dad in my life. I have my family. And, like, I could not be in a better position as far as those things are concerned. I hit the friend lottery and the family lottery. I
Yes.
certainly did. But
Yes.
when I see homeless veterans in the streets, when I see, women like April out there who recognize how bad things are, and she's out there trying to save somebody's life, but, these people are going in and having this kind of experience. It is frustrating to me. I don't want anybody else to deal with that, and I wish there were a way to just pay for these mammograms for people. Just pay for them, and it be just a done deal. They don't get any more letters, no more phone calls, no more confusion, no nothing. And even that seems to be kind of an uphill battle too.
Well, with that being said, let's end this and give people, some time to digest this discussion. And I would love input, just to end this on a good note, of ideas. Like, what are your ideas for how to combat this? And maybe we could bring this to our legislators. I know that they've tried in Tallahassee. They did pass it where they're supposed to tell you how much something's supposed to cost, but it feels like these hospitals or whatnot, doctors' offices, have just found a way to be like, this is what this one cost is. We're just not going to tell you about the rest of the cost. So how do we address that?
Right.
So maybe help us address and navigate and come up with ideas and solutions, because we're all about solutions. And, a big part of the work that we do, I say environmental health, emphasis on health. So I hope that we will be back on 2 more times today with other people to talk about other topics. And please get on here and let us know how you feel about this situation, and we will talk to you guys soon.